welcome to the 2018 Big Squeeze Kickoff. We're excited to have you here as we celebrate the start to our month-long promotion to increase awareness of high blood pressure throughout the Sioux Falls community and encourage Sioux Falls area residents to check their blood pressure. I should let you know it's an honor to be here today. I'm Jill Franken, I'm the Public Health Director with the City of Sioux Falls. And I need you to know that high blood pressure is a serious health issue, but it can be managed. But to manage blood pressure, you have to know your numbers, and that's what the Big Squeeze is all about. As you may have heard, new blood pressure guidelines from the American Heart Association released last year are encouraging patients, healthcare providers to have conversations with all of us about high blood pressure even earlier than before. And the new guidelines place a special emphasis on the importance of healthy lifestyle habits. It's very fitting today that today also begins our National Public Health Week, which is an opportunity to celebrate a strong public health system and to recognize the power of prevention and partnerships to improve the health of our community. Everyone, all of us, deserve to live a long and healthy life. And we deserve that in a safe environment. To make this happen, we must tackle the causes of poor health and disease risk. Our Live Well Sioux Falls team will be highlighting many examples of public health this week with a social media campaign called This is Public Health, and I'm really excited about this. You can connect with Live Well Sioux Falls on Facebook or follow them on Twitter at LiveWellSF. We are so grateful also to have Sanford Health hosting us today in this lovely facility. And I would like to now turn it over to Paul Hansen, Executive Vice President of Sanford Sioux Falls. Paul?
Thank you, Jill. On behalf of Sanford Health, I want to welcome all of you to our Imaginetics building for the kickoff of this important community event. At Sanford Health, we are dedicated to the work of health and healing, and every day we show that commitment of delivering the highest quality of care and providing patients with convenient access to expert medical providers, leading-edge technologies, and world-class facilities. In addition to strong clinical care, we are also committed to research, education, and community growth. We engage in medical research not only to discover innovative ways to provide care, but also cures for common diseases. We continuously seek new ways to achieve our vision of improving the human condition. Our entire Sanford team recognizes the value of healthy people, healthy families, and healthy communities. Investing in prevention efforts like the Big Squeeze helps our friends and neighbors reduce the risk of high blood pressure and other more serious health conditions. As we likely know, high blood pressure increases the risk of heart attack, stroke, and leads to kidney and heart failure. Fortunately, high blood pressure can be controlled and in many cases prevented. Lifestyle changes are at the center of that prevention. The first step is to simply get screened. And as a testimonial, I believe that last year's event, I did get screened and I did have high blood pressure. And because of that, I've taken an intervention to reduce my blood pressure going forward. So to this particular project and this particular community initiative, I am thankful, and so is my family. Hypertension is no longer a condition that's associated with the elderly. In fact, we are known from previous Big Squeeze screenings, say that 4 times really fast, that half the men and a quarter of women ages 18 to 24 have an elevated blood pressure. This is why we are encouraging you to know your numbers and take the appropriate steps. We applaud the efforts of the Sioux Falls Health Department through their Live Well Sioux Falls initiative to make Sioux Falls a healthier community, and we look forward to supporting the efforts of the 2018 Big Squeeze. And again, thank you all for joining us here today.
Good afternoon, Mary Michaels with Live Well Sioux Falls. Last fall, the American Heart Association released updated blood pressure guidelines for the first time in a number of years. And really, it places the focus on more discussions between patients and their providers about their blood pressure and how to manage their blood pressure. So in the past, you've always heard that 120 over 80 is kind of the normal, and previously 140 over 90 was high. But the new guidelines, that high threshold has been lowered to 130/80. And so really it doesn't necessarily mean that people are going to be on medication more. It's those conversations need to happen about lifestyle changes, healthy diet, exercise, not smoking, alcohol in moderation, and really having those conversations early on to prevent the complications from high blood pressure.
I want to extend a special thank you to our Big Squeeze partners, many of which are here today, and they include the American Heart Association, Augustana University, Avera Health, Lewis Drug, National American University, Sanford Health, South Dakota State University, the University of Sioux Falls, the University of South Dakota, and Walgreens. Together, we can raise awareness about high blood pressure, and together we can save lives. Getting a blood pressure check is quick, it's painless, it's very simple and convenient, with many sites throughout the community where you can get a screening, like pharmacies, work sites. So again, we encourage you to get yourself screened, and while you're doing so, take a picture of yourself doing so and post it on social media with the hashtag BigSqueezeSF. For those of you looking for more information or ways to get involved, please visit www.thebigsqueezesf.org. Thank you again to Sanford Health for hosting us today, and thank you all for coming. Thank you.